All right, we're going to talk a little bit more about the hip. This time we're going to talk about the gluteus medius. We know how important that is in terms of our hip stabilisation. So obviously a lot of our running athletes come in and unfortunately they have a lot of tonicity in that glute med. And we can obviously dry needle, we can plough through that and obviously trying to draw back that tonicity. But sometimes I think we really miss the gate in terms of looking at obviously another part of this in terms of, especially if we're getting increased tonicity, and that will be the opposing muscle, which for all of you will be aware, that adductor magnus. So it's a big, powerful muscle. I know it restricts our hamstring range of movement, but also it plays a really big important, especially because it's the antagonist to the glute medius. So I think it's really going to be a helpful technique for you to look at when you're using especially with athletes with hypertonicity in those glute medius muscles. All right, so the way that we do this, and I do with my athletes as well, obviously you want to make sure that they're draped, feeling comfortable, bringing the leg out. So first just test what the hip abduction is like. Okay, so for Tess, she's actually really quite flexible through here. You're not probably even feeling it, are you, Tess? No, a little bit. Okay, so the key areas we want to look at here, does she feel it in the glute? Does she feel it in the upper part of the adductors or the lower part, or even into that mid portion? So it could be adductor longus. Obviously magnus is the most common one that I see, or even if it's down lower in that magnus area as well. For most part, we'll tend to find it over in this area here. So the way that I approach this, place the knee over the top of the, pull pretty much your TFL, just bend at the knee, a little bit of knee flexion, and then that we can start to do some release work through here. So we've got good access, and the thing is we want to work this muscle while we're working through the range of movement. Okay, and we've got two trigger points up high here, and we've got another one in the mid part of that muscle. But really this is a release technique that we're looking at. So once again, a little bit of pre-max. Okay, just a broad approach first. Okay, remember this is a delicate area, so if your athletes have not had any work done here beforehand, just slow and gentle, okay? It's not about trying to work or rush this area, okay? Because these passive release techniques basically work on you engaging with the tissue and letting it basically melt. Okay, so stabilize at the back of the knee here with your hand. Come in with a loose fist is what I used to claim. It's probably the best tool that you can use. Okay, so I'm just going to engage the tissue. Obviously, longus is here. If I come down just below it inferiorly, I pick up that magnus. Okay, so we're just working through there. And as we work, I can just slightly take the hip into a little bit of flexion and abduction. And that's comfortable, isn't it, Tess? Yep. You've had this hundreds of times, Tess, so we know you've definitely get some value from it. So yeah, so the reason we work this magnus is because we're trying to play on that theory of reciprocal inhibition. So I don't necessarily tend to find, especially in these sort of runners, weak glutes, which gets thrown around a lot. I tend to find that they're inhibited, and inhibition is a big difference between having weak glutes, and a lot of the time that inhibition is obviously held or masqueraded, if you like, because of the antagonist muscle. Okay, so you can see that I'm working quite slow. I'm not trying to rush this by any stretch of the imagination, working up into hip flexion as we increase that range of movement. Simple technique, looks simple, but there is a little bit of an art to it, and it is engaging that tissue, making sure that your clients feel supported as you work through there, and make sure that you work the tissue all the way up. Good. All right, adductor magnus and glute medius.